All right, we're starting on skull lines and landmarks. These are the most important, really, things to know when working with positioning for anything in the head, face, anything like that for x-ray. So the skull morphology, there is the mesocephalic skull. That's the skull of average shape. The width is 75% to 80% of length. All of the positioning, central rays, angles, anything like that is based off of this type of skull. So there's three here. We have the mesocephalic, what we just talked about, right? That's sort of what we're basing it off of. And then we have the brachycephalic, and then the dolichocephalic as well. So the doli is less than 75%, brachy is 80% or more, and the meso is 75 to 80%. Just a quick plane review. Mid-sagittal goes down middle of the body, separating into right and left halves, and then mid-coronal separates into anterior and posterior. So we're going back through those and using those still throughout any of our central rays and that kind of stuff. The glabella, you can see on the image here where it sits. That'll be one of your central ray points. It's a smooth, raised, triangular area between and slightly superior to eyebrows and above the bridge of the nose. The nasion is located at the junction of the two nasal bones and the frontal bone, so it's in here. Look just under the glabella. The acanthion is found underneath the nose and above the upper lip. This is just a picture here of the positioning lines, and then we're going to go through those separately. So these are sort of what I want you to know, and there's a quiz for this too. The GAL, Glabelloalveolar line, is this one coming across here, right in front of the face. It connects sort of the anterior aspect of the alveolar process of the maxilla, kind of coming in the front here to the forehead, all right? It's basically the plane of your face. Glabellomeatal line, or GML, is a line between the glabella and the external auditory meatus, which is your ear, right in here. Okay. Orbitomeatal line, OML, this is one of the ones we use most often. It's the line between the outer canthus and the external auditory meatus, so EAM. And almost all of these are to the EAM, right? Infraorbital meatal line. Okay, so it's on the inferior margin of the orbit to the EAM. And IOML is another major one for us. So it's usually, a lot of the times, OML or IOML. Okay. Acanthomeatal line goes from the canthion to the EAM. Mentomeatal line, you'll find here, which is coming from the mentum to the ear. Lips meatal line, LML, is lips to ear. This one is very rare. I think there's only one possibly position that uses this one. Interpupillary line, so in between, coming across, in between the two pupils. So if you're looking at your patient straight on, as if she were your patient, I look to see if the pupils are even across to help me determine if my patient's lateral. Degree of difference. This tends to be a question they like to ask. There's a 7-degree difference between OML and IOML. So keep that in your notes somewhere. The superciliary arch or ridge, okay, is this arch over here, right above each eye. Supraorbital groove, abbreviated SOG, foramen or notch. You might see it both ways. So ridge, notch will be up here in this upper portion. It's a small groove in kind of this upper portion of the orbit. Right. Orbit, either inner or outer canthus. Excuse me. Supraorbital margin, SOM. That'd be your superior rim, the bony orbit of the eye. Inferior margin, pretty self-explanatory. Inferior part of the orbit. The inion, that's this one here in the back. Okay, right in this location, prominent point that you can palpate. Gonian, or angle, right, is right here on the mandible. Mentum. So the mental region is your chin. The mentum is the most medial point of the chin. Okay, for ear, EAM is the major one that you're going to hear most often with any head work. So EAM is the external auditory meatus. That's this entrance here to the ear. Auricle or pinna, that's the large flap of the ear. Tragus, small cartilage flap that covers the opening of the ear. And then TEA, top of ear attachment. That's the superior attachment of auricle. That's when you put your glasses on or goggles on for work, they rest on the ears, right? TEA corresponds to the petrous ridge of the temporal bone. That's something just to keep in your pocket. Sometimes that's a test question, okay? Here's a quiz for you. Practice your lines in areas of interest. And then another one, practice knowing all your lines and landmarks. And then I want you guys to start reviewing your skull anatomy, okay? Frontal anatomy, side anatomy. Here's another picture of the side, the lateral view, posterior, and this inferior, okay? Make sure you know those as well. Okay. And this area here is always on there. The vomer, the maxilla, those bones here. There's a lot of foramens within the skull, right? I know there's a lot to it, so really work on that skull anatomy.